Bone cancer. What to know? Bone cancer develops in the skeletal system and destroys tissue. It can spread to distant organs such as the lungs. The usual treatment for bone cancer is surgery, and it has a good outlook following early diagnosis and management. The two main types are primary and secondary bone cancer. In primary bone cancer, cancer develops in the cells of the bone. Secondary bone cancer occurs when cancers that develop elsewhere spread or metastasize to the bones. According to the National Cancer Institute, primary bone cancer accounts for less than 1% of all cancers. Secondary bone cancer is more common. Types. There are several types of bone cancer. Primary bone cancers. Tumors in the bone are either benign, non-cancerous or malignant, cancerous. Benign tumors do not spread beyond their original site. Malignant tumors are more aggressive and have a higher risk of growing and spreading. Examples of benign bone tumors include osteoma, osteoid osteoma, osteochondroma, enchondroma, aneurysmal bone cyst, fibrous dysplasia of the bone. Osteoblastoma and giant cell tumor of bone may become malignant after starting as benign. They will usually become aggressive without spreading to distant sites and cause damage to the bone near the tumor. Examples of malignant primary bone tumors include osteosarcoma, Chondrosarcoma, Ewing's sarcoma, malignant fibrous histiocytoma, fibrosarcoma, chordoma, other sarcomas. Multiple myeloma is a blood cancer that may lead to one or more bone tumors. Certain bone cancers develop in specific bones. For example, teratomas and germ cell tumors mainly occur in the tailbone. Osteosarcoma. This type of cancer develops in osteoblasts, which are the cells that form bones. Osteosarcoma is the most common type of bone cancer. Children and adolescents aged 10 to 19 years have the highest risk of osteosarcoma, and it is the third most common cancer among teens in the United States, having Paget's disease of the bone, which is a disease that causes excessive bone growth, also increases the risk of osteosarcoma. Ewing sarcoma. Ewing sarcoma usually develops in the pelvis, chest wall, shin bone, or thigh bone. However, it might also develop in supporting soft tissue such as fat, muscle, or blood vessels. This is a rapidly growing tumor that often spreads to distant sites in the body, such as the lungs. It is most common in adolescents between 10 to 19 years of age, although it is the second most common type of bone cancer in children and teenagers. It is very rare. Chondrosarcoma. Chondrosarcoma usually develops in adults. It starts in cartilage, a type of connective tissue that lines the joints, and then spreads to the bone. Most commonly, it develops in the upper leg, pelvis, and shoulders. Chondrosarcoma usually grows slowly. This is most common in adults over the age of 40 years. Chordoma. This is a very rare cancer of the spine. It usually develops at the bases of the spine and skull in older adults. Children and adolescents can also develop chordoma. When this occurs, chordoma usually begins to grow at the base of the neck and skull. Secondary bone cancers. They are the most common bone cancers in adults. They develop when a cancer spreads to the bone from elsewhere in the body. Most cancers can spread to the bones. However, people with breast and prostate cancer have a particularly high risk of developing secondary bone cancer. Doctors know this as bone metastasis. This type of cancer can cause pain, fractures, and hypercalcemia, which is an excess of calcium in the blood. Treatment. The type of treatment for bone cancer depends on several factors, including the type of bone cancer, its location in the body, how aggressive it is, whether it has spread. Symptoms. The first symptom for a person with bone cancer is nagging, persistent pain in the affected area. Over time, the pain gets worse and more continuous. For some people, the pain is subtle. An individual experiencing this pain may not visit a doctor for several months. The progression of pain with Ewing sarcoma tends to be faster than in most other bone cancers. Swelling in the affected area, weak bones that lead to significantly higher risk of fracture. Unintentional weight loss, a lump in the affected area. Although much less common, a person with bone cancer might also experience fever, chills, and night sweats. Staging and grading. Staging and grading a bone tumor allows doctors to decide on the best course of treatment and the most likely outlook. Grading involves looking at the cells of the tumor under a microscope and assessing how they differ from healthy bone tissue. A grade 1 tumor has cells that resemble bone tissue, while a grade 3 tumor has more abnormal cells that suggest a more aggressive cancer. Staging a tumor indicates its size and spread. Several different characteristics can continue the different stages.